Greetings from Trinidad and Tobago. I'm Dr. Bridget Elcock-Straker, presenting some very interesting research on religious leaders' perspective on organ donation and transplantation in a developing country. Trinidad and Tobago in the Southern Caribbean is the only English-speaking Caribbean country with both living donor LD and deceased donor DD kidney transplant program. The population of 1.4 million is multi-ethnic, multi-religious, and 2022 marks the 61st anniversary of our first retrieval and transplant, that is of corneas, the 34th anniversary of our first living donor kidney transplant, and the 15th anniversary of our first deceased donor kidney transplant. Legislation in 2000 with regulations in 2004 govern this program. Transplant. It is a fact that many nationals in Trinidad and Tobago are unaware of organ donation and transplantation, and this can happen in a legislatively protective environment because of our laws about donation. When patients' families are approached about donating organs, people who are reluctant often use religion as their reason for refusing organ donation. So the research question is, could education of religious leaders about organ donation and transplantation increase knowledge and acceptance of organ donation in our local community? The methodology was an anonymous survey of the personal knowledge of religious leaders on organ donation and transplantation that was done before and after an online educational video on organ donation and transplantation. Leaders of our main faith-based organizations were contacted via telephone. The inclusion criteria was 18 years and older. Verbal consent was given via the telephone call, and if they agreed, they would provide a voluntary provision of their email address, and the email would be sent to them with an explanation, instructions, the survey form, and the educational video. There was ethics committee approval for this. The online educational content was a 17-minute video presentation on what kidneys do, how one cares for one's kidneys, risk factors for kidney failure, what is donation and transplantation of organs, who can be a kidney donor, and the various religious views on donation and transplantation, why donate and how to register to be a donor. The anonymous online survey of the personal knowledge of religious leaders on organ donation and transplantation consisted of 19 points. These were demographics 3, organ donation and transplantation general knowledge 4, religious beliefs organ donation and transplantation 6, and personal beliefs regarding brain death, receiving and giving of organs for oneself and for one's loved one 6. The survey of religious leaders showed that they were mainly 50 years and over, that's 88.5%, 62% were male. 92% knew that organ donation and transplantation was occurring in Trinidad and Tobago, and 94% knew that there was a legal requirement for doing organ donation and transplantation. 70% knew someone who was awaiting or had had a kidney transplant, and 72.5% believed their religion supported living donation, while 66% believed that their religion supported deceased donation. 100% of participants believe that they would counsel a fellow believer to donate their organs. Is a brain dead person legally dead? 50% said yes. And 96% were willing to receive an organ from a deceased donor, but only 66% who were willing to donate their organs after death. In terms of a loved one's organs for donation, if there was no prior discussion, only 49% would consent to their loved one's organs being donated, but that figure increased to 100% if there had been prior discussion while the person was living. The survey was very interesting because we found that many of the religious leaders said they would consider issuing a position statement from their religious body after internal consultation. In fact, the main Muslim body, this is the ASJA, they actually issued a fatwa after convening their scholars, and this fatwa was in strong support of organ donation and transplantation, and it's shown on the right of the slide. The limitations of this study were that of the anticipated 20 faith-based organizations that were approached, only 10 participated. Therefore, the sample size, which was expected to be 80, there were only 32 participants. Only 15 of these 32 did both before and after surveys, before and after viewing the educational video. 9 did it before only, 8 did it after only. There were a few participants who had technological challenges, as 88%, you will recall, were over 50 years of age. It was therefore impossible to conclude the effect of organ donation education on changing their views. Some FBO leaders, notably the Orishas, were very reluctant to view the video, to participate in the survey, and to even discuss what their misgivings were with the researcher. I was, however, able to discover that some linked it to human trafficking, organ donation and transplantation. They believed it showed disrespect to the human body. So in conclusion, our religious leaders showed very good, highly supportive positions towards organ donation and transplantation, very good knowledge of the topic. Most all believed that their religion supported organ donation and transplantation, and there was some reasonable understanding of the concept of brain dead. There is therefore the opportunity for making organ donation, transplantation understanding part of a more empathetic end-of-life care and bereavement counselor training. And if we can obtain buy-in from these influential leaders, it would certainly go some distance improving public acceptance of organ donation and transplantation, helping persons in the community to understand the concept of brain death, and to enhance their standing as community change agents. These are my 8 references. I thank you for your keen attention.